2 years ago, the medical community was warning about a rising epidemic of teens using e-cigarettes or vapes. Now, after a global pandemic impacted so many aspects of our lifestyle, Stacy Shibley explains how those vaping trends have changed.
The pandemic has changed so many things, and now doctors suspect it's also changed how and what teens are vaping.
Some teens are now kind of manipulating or hijacking their vape products in order to put different substances, and one popular one would be marijuana. And so I am hearing a lot more teens kind of disclose that marijuana has sort of increased in that arena.
With recreational marijuana now legal in 14 states, teens might not think there's anything wrong with vaping pot. But Dr. Reese, who is the director of adolescent medicine at Johns Hopkins All Children's Hospital, strongly disagrees. A big part of the problem is that kids don't know exactly what they're putting in their bodies.
Now we know that potency for marijuana back in the day to now has drastically changed. Most times teens don't know how potent what they're ingesting is. So if they're getting it from their friends or from, a friend's friend or somebody who's selling it, right, they're likely to not know the potency of that.
Dr. Reese says anxiety, panic attacks, and even psychotic events have been linked to very potent marijuana. Not to mention what vaping in general does to the heart and lungs.
The heart and the lungs are very much related. They really depend on each other to function optimally. And so if we're in consuming or inhaling or ingesting any toxic substances that could potentially harm the lungs, we can assume that too it's going to affect the heart.